Malungelo, a very good afternoon to you, and tragic news that we hear coming out this morning. The MEC Bandile Masuku confirming that 2 staff at the facility have tested positive for COVID-19.
That's right, Tammy. Those 2 staff members testing positive for COVID-19. Bandile Masuku confirming those news to us exclusively and also telling us that those 2 staff members are currently in self-isolation and that they have been in self-isolation for about 2 weeks now, and that they were waiting to do final tests to see if these 2 staff members have in fact been cleared of the virus. Tammy?
Is there any indication of how they may have contracted the virus?
Well, Bandile Masuku did not give us a lot of detail as to how, Tammy, these 2 employees in fact contracted the virus, but he says he was given an explanation by the hospital as to how these 2 employees contracted the virus. But what we know, Tammy, for a fact from speaking to some of the sources that we've been talking to while working on this story is that these 2 employees had been working on a COVID-19 patient, and some sources in this facility also telling us that these 2 employees, that when they attended to this employee, they actually did not have protective gear, the PPEs, and that they were quite exposed actually when they were working with this patient who we understand has since died. And that's how some people that we've been talking to, in fact our sources have told us that that's how these 2 employees have in fact contracted COVID-19.
What we've seen, Malungelo, is traditionally when the staff at a hospital are found to have COVID-19, the hospital shuts down, it gets quarantined and closed. Is the same happening at the ARWYP?
Well, you're right. We've seen in some provinces, really, hospitals where employees have tested positive for COVID-19, the facilities would close down and there would be quarantine. But, well, this hospital has not shut down at all, Tammy. It is still operating. But what is currently happening is that they're using this entrance, which would be used daily by people, has been closed. Now they're using one entrance, which is on the right. But I asked Dr. Bandile Masuku as to why this hospital has not been closed, considering that there are some patients that have tested positive for COVID-19. And this was his response to me. Take a listen.
Could be determined per facility and the extent of the spread within the facility. But in terms of the portfolio of evidence that they presented their schedule, daily actual schedule that they do in terms of disinfection. They've provided the schedule of actual fogging, and they've also provided the portfolio of evidence how they've separated the pathways and how they separated the wards. But it's something that also the Prof is going around now ascertaining as the HOD of the department. But from where we are, I think they are doing it. It might not be enough, but we are hoping that they will improve as we go.
So we see there, Malungelo, you having a one-on-one with MEC Bandile Masuku. What else did he have to say?
Well, here's what he has also told us, Tammy, that what's actually going to happen, because he's been given a portfolio of evidence really as to what the hospital is doing in terms of assisting staff in protecting them from COVID-19. What he's done is that he's asked some of his director generals to actually check whether what he has been told, what is on paper, is actually happening, is exactly happening in the hospital. So he's saying that you can believe what the hospital is saying based on what's on paper, but what he also wants to do, he wants to satisfy himself and also get a report from his officials that will be assessing and making sure that what officials have put down on paper is actually happening in this hospital is true. But I think it is very important for us to state that Dr. Bandile Masuku's visit to this hospital has been sparked really by our investigation into claims by some staff members in this particular hospital that they were treating a COVID-19 patient without proper PPE, and that's why he decided to come here. It's something that the MEC too has acknowledged, saying that he actually wanted to get information from the hospital itself.
Now, Malungelo, what has been the reaction from the hospital? Have you managed to speak to any of the employees there about what has transpired, the fact that there has been a death, the fact that the MEC has indeed come to visit the hospital, and the lack of protective equipment?
Well, Tammy, look, we have not been able to speak to some of the employees. I mean, when we arrived here in the morning, people were curious as to why we're actually here. And instead, I posed the questions to them as to what was happening at their hospital. And people were saying that they don't know. And I suppose, though, a lot of people perhaps might be surprised by what's coming out of this particular hospital. But the MEC said something that was very important in my conversation with him, Tammy, saying that he really wanted to prevent what happened. He really did not want to see what happened in hospitals in KwaZulu-Natal, where a lot of employees get infected with COVID-19 and hospitals are shut down, and there's also this high level of secrecy from some of these facilities. What he's saying that his engagement with the facility was to ensure that there's that openness and transparency, and that's what he essentially wants to see going forward.
Now, this is an exclusive, Malungelo. Give us a bit of background as to how the whistleblower alerted you of what was actually happening.
All right, Tammy. I mean, this is something that we've been working on for about, 2 weeks now, and one of the sources here at the facility alerting us about about staff members that had, in fact, working with this COVID-19 patient without any protective gear. And I think one of the things that the whistleblower or our sources had raised to us were the concerns that they have, that it seems as if nothing really, this thing is being hidden under the carpet and no one is saying a lot about it. And one of the things, Tammy, that was also worrying to some of the people that we have been speaking to, or our sources in this particular hospital, is that some staff members essentially don't even have unions, in my understanding. So the unions would essentially take their plight and present it to the management. But what we also know is that some of these, there were complaints that were raised to the Human Resources Department when those employees were essentially made to work